Thank you, Jonathan. I'll just give an update that sort of sets the scene for the rest of the public board meeting. It's no surprise that we've been dealing with a significant fourth wave of COVID infections in the community, which has led to an increase in admissions and unfortunately also a number of patients that have died with COVID in our hospitals. There are signs that the peak of the fourth wave are behind us now, which is good news. But of course, this will be relieving some pressure, but we still have significant COVID pressures on our services. And no doubt there will be a fifth wave building in the future. So we are preparing for a continued COVID service in our hospitals, which of course has significant impact in terms of the pressures on our staff. In contrast to the previous waves, we have a relentless attendance at A&E in both of our A&E sites, very large numbers, and it's also more difficult to get patients back home than during the previous waves because there's less support available also in patients' homes because people are back to work. So there's a very high pressure in the emergency services. I must say that the clinical teams are doing an amazing job at increasing productivity in outpatients, in diagnostics, in the operating theaters, so that we can diagnose and treat as many patients as possible with the limited capacity we have available. And we'll come back to some of that. So not a surprise, a lot of the report that we submitted for the public board in terms of my update was focused on staff well-being. It can be understated how difficult the pandemic has been and still is for our staff in terms of pressures that really feel relentless. And so we are focusing a lot on supporting them, also making sure that they can speak up. We'll talk about the Freedom to Speak Up initiatives. We're working along staff to make sure they're all vaccinated for flu and against COVID, and we'll have some more updates on that as well. And then there's a lot of focus, as you were saying earlier, Jonathan, on collaborating with other providers in Oxfordshire. You mentioned specifically Oxfordshire with GPs, community services, social care, to be able to sort of work together as a system to deal with the urgent care pressures. But we're also collaborating with other NHS trusts in the BOP ICS on some of the routine elective diagnostics and treatments. And there's a very strong collaboration across Thames Valley with trusts that actually cover several ICSs and regions in NHS England for the more specialized services. And I think those collaborations have really been deepened during the pandemic, and we're sort of building on those strong personal and institutional relationships to make sure that we can manage these relentless pressures that we're dealing with. So the report gives a lot of great examples of things we've done to support staff, but also great examples of celebrations of the contributions that staff have made. And I'm not going to read them all out because it's an extensive report, but more than happy to answer any questions on that.